If you got OA, also known as osteoarthritis or bone on bone or degeneration, that's a result of many microtraumas throughout life, or it could be due to a major trauma and something being misaligned, and then it's more likely to degenerate, but it is degeneration. And in the spine, we call it degenerative disc disease, where the discs get thin, the cushions between the bones, our body starts adding more bone, we have osteophytes, we have bone on bone, we have grinding. It's something we like to prevent in the first place, in the periphery, or say in the knee joint, it'd be degenerative joint disease. But the principle remains the same. So if you're somebody that already has it, which is super common because it's a result of wear and tear over time, then what can I do for it? Well, you want to do light weight-bearing, low-impact exercises, things like swimming, right? Aquatic exercise is great for so much. Aerobic exercise in general, right? Going for a jog, going for walks, great. Pumping blood into the cushions between those bones, into the cartilage, helping to feed them oxygen and nutrients, helping to preserve their height and function, right? Things like Tai Chi, things like yoga. These are all good. Light resistance training. These are all good for somebody with osteoarthritis, right? Now, on top of that, there are a bunch of supplements that we could take, and probably the top one, well, before we get into supplements, you also like to lose some weight, right? Common sense. Losing weight is a good thing because it will put less stress on the joints in the first place, right? So we're trying to slow down the further degeneration of this cartilage so it's not completely bone on bone, right? That's what we're looking to do here, and we need to feed them blood, we need to feed them nutrition, we need to do some weight bearing, some exercise, got to keep moving. And in terms of supplements, one of the top, curcumin. Curcumin, standardized for 95% curcuminoids, taken at 500 milligrams 3 times a day, alongside 20 milligrams of piperine 3 times a day. It's an extract, comes from black pepper, also could be seen as black pepper extract. It improves the absorption of the curcumin. Make sure, again, it's standardized for 95% curcuminoids. Those are the bioactive compounds responsible in the curcumin for reducing joint stiffness and joint pain, improving joint mobility in the first place, right? So curcumin is a great option. 40 milligrams of undenatured type 2 collagen would be another good thing to take. And 3 grams of combined EPA and DHA omega-3s in a day. Absolutely. And omega-3s are great for your heart and for your brain and so much else, also for your joints. And if we want to reduce some joint stiffness and joint pain, improve some range of motion, just make the joints healthier, bada bing, bada boom. Those are some of your top 3 options right there. If after a week or two we're not feeling any results really, then we can add in black cumin oil. It's 7.5 milliliters a day. And we can also add in something called pycnogenol, aka pine bark extract. But if you're going to do that, make sure it's standardized for 65 to 75% procyanidins. Those are the compounds responsible for helping to reduce joint stiffness and joint pain and improve joint mobility, as really all of these do, right? At least purportedly. And so, these are some of the top proven things to do so that are natural. Now, if we still aren't seeing results, we can add in methylsulfonylurea. Now, well, pine bark is especially good for who? A type 2 diabetic that's osteoarthritic, because it also helps to improve blood sugar control, right? So it makes for a great option there. If you're a type 2 diabetic, also you talk to your doctor about things like berberine and inositol and check your magnesium levels. Now, among a few other things, but those are some big ones. Now, when it comes to, that's natural at least. I'm not saying this is first line for type 2 diabetics, just as a disclaimer there, right? I had to think to make sure I said that. Now, if you're still not seeing results with all that, methylsulfonylmethane at 1,125 milligrams 3 times a day can be added in. It's also a synergy with a lot of the aforementioned ingredients, can help to improve their efficacy, and so it makes for a great option as well, potentially here. Now, after a month, if you still aren't feeling anything, go for Boswellia serrata. Boswellia serrata, taken at 1,800 milligrams 3 times a day if it's the gum oleoresin, or if you're going to get a patented form like aflapin or 5-loxin, you could take 100 to 250 milligrams in a day. Now, as for the curcumin, again, there are patented forms for that. If you don't find one that's standardized for 95% curcuminoids at 500 milligrams 3 times a day with combine 20 milligrams of piperine, even 10 milligrams should probably do the trick to absorb, but 20 is pretty safe. 3 times a day. You could go for a patented form, BCM 95 or Mariva, and if you take those, you could have 500 milligrams twice a day instead of 3 times. So sometimes these patented forms are nice. You can take a little bit less. It's more potent. It's more the active ingredients that are in it, and so we can obviously be happy if we're ingesting less and getting the same results, right? Principle of liquor for the people. We don't condone that. So why not chondroitin or glucosamine, right? You guys are probably saying, what about chondroitin sulfate, glucosamine sulfate? Well, if you were going to take them, it would be chondroitin sulfate 600 to 1200 milligrams in a day divided over 3 doses, and it would be 1.5 grams of crystalline glucosamine sulfate in a day divided over 3 doses. But the reason we didn't mention them first, or almost at all, is because they're more for preventing the joint degeneration in the first place. If you already have OA, you have joint stiffness and joint pain, they're probably not going to help with that. They're more of a prophylactic thing, a preventative thing to help maintain joint integrity and function as we go through life and to help prevent it in the first place. So that's what we got for you guys today. If you have OA, I hope this was helpful. Who do we got on here? Let's say hello to the people. And we're going to go do something fun. Mano Salva. Sapar. Amumuns. How you doing? Ma, what's up? Thank you. Sebastian. Melanie, what's up? Edwin. Eddie Rodriguez, my man. J. Romes. Medium high simmer. Stefan Fire. Gee, what's up, man? How you doing? And Berlin Bat, first one on today. This one's for you. I hope you had a great day. Happy Win Wellness. That's all we got for you, folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have a great one. Thanks so much, and happy Win Wellness. We'll see you later. Ciao.